More people are starting to use remote care services to improve the healthcare they receive. Due in large part to the relative ease and control that patients have with their personal health, things are made more efficient at hospitals. With less patients coming in for doctor patient consulting, money is better allocated towards things around the hospital. The idea that was discussed in the article was to have primary care doctors use virtual online technology. Their goal is to create new hospitals, ones that take care of patients that are in danger. Everything else will be accessible in the home. This new type of innovation is interesting because it shows a glimpse of the future of healthcare. But to reach that point, work must be done to improve user interface. One of the major detractors for telehealth is the technology learning curve. Usage of the product requires knowledge of the device and an understanding of the software. Until the product can be simplified for universal usage, it will be hard to implement a system that's so reliant on technology.
Hi, my name is Ivy, and in the first article, healthcare systems and its evolving technology are helping patients manage themselves and their own records. The paper talks about CF, which is a genetic condition found most commonly in Northern Europe. This paper talks about how technology is being used for the target audience who are affected by CF. This includes the new responsibility that comes with self management and clinic attendants and patients who are often very actively engaged. By seeing what works and what doesn't, the health providers hope to understand the structure of CF better. In the second paper, telehealth is also discussed. I think although it is difficult to transition into the world of universal telehealth systems, it is just a learning curve and it is evolving to better the relations between health providers and patients.
Articles talked about telehealth, and in short, telehealth is the term used to represent the transfer of medical information through different platforms. What I mean by this is it can be the transfer of still images, uh, patient consultations like through video conferencing, or just remote controlled monitoring of a patient. Now, with this, there's several pros and cons to this. One pro is that you do expand your patient base as you have access to more patients from the comfort of their own home. With this, it is also cost efficient as it reduces the amount of in office visits the patient has to do. One con, though, is physical examination for the patient is limited because, as through video conferencing works, you can't physically examine the patient as he's on the other end. But you do get the pros of being able to consult with him from the comfort of his own home.
This week's topics revolve around a move towards telehealth and more patient self-care management. The paper regarding cystic fibrosis talks about how patients with cystic fibrosis might benefit from the technological advances of the modern age. Wearable tracking devices, mobile applications, and electronic health records are some of the technologies that help the patient with monitoring their condition. These are some ideas I came up with in order to tackle the challenges presented in the paper. One problem was that it was hard for patients and doctors to know that their data is accurate on the patient's habits. Smart hardware, such as pill dispensers that could automatically log in medication taken, could help with this. Another problem was the burden of clinic attendance is high for patients. A solution to this may be to optimize the meetings with the multidisciplinary team. The order that the team goes to meet patients in may need to be organized in a way that the waiting times are limited. The last problem also connects to the second article. A move towards more telehealth-based care could break the important trusting relationships that patients and doctors develop. A solution to this is that the patients could first do inpatient appointments and then further their virtual care that can somehow link to the specific physicians that the patients want. A move towards telehealth for the medical industry in general presents some problems that I thought of. Would a move towards telehealth unintentionally harm poorer populations? The poorer populations may have less access to the kinds of technology that may be needed for the telehealth move. Another problem could be with the future view of a disassembling of the current medical centers to virtual centers. The trust between patients and physicians could be broken. Furthermore, the level of care at physical hospitals could diminish as they become fewer and smaller.
On average, about 90% of healthcare organizations are using or piloting remote patient care services to help patients who are at risk and help make healthcare seem more cool and popular. However, there still seems to be a societal trend and a preference of in-person consultations and visits, not just by patients, but by providers as well. However, the majority of providers are moving in this direction of a new frontier of health, and few are prepared to manage it. Only half of those providers will be able to safely store high volumes of user data, and fewer than half are able to establish a secure and exclusive connection between a doctor and a patient. However, there is an even greater challenge with patients, as only 26% have reliable internet connection, and other disparities, as well as not having a good camera or a well-equipped phone. However, technology is growing and evolving and will only improve over time.